Liver cirrhosis symptoms. Did you know that the liver has an incredible ability to regenerate? If liver cirrhosis is diagnosed early enough, most, if not all, of the liver damage can be reversed. In this video, we'll be going over 12 signs you may have liver cirrhosis. Number 1. Bruising and bleeding easily. People with cirrhosis often bruise more easily and may experience prolonged bleeding after minor injuries. This is because your liver plays a key role in producing clotting factors, proteins that help the blood clot when needed. When your liver is damaged, its ability to produce these clotting factors is reduced, leading to an increased tendency to bleed. Even small bumps or cuts can cause large bruises or prolonged bleeding, and in advanced cirrhosis, spontaneous internal bleeding can occur. This can manifest as blood in the stool or vomiting blood. If you notice excessive bruising, frequent nosebleeds, or cuts that take a long time to stop bleeding, it's essential to consult with a healthcare provider. Addressing liver function early can help prevent more serious complications related to bleeding. Number 2. Ascites. Ascites refers to the abnormal accumulation of fluid in the abdominal cavity, which can cause visible swelling and discomfort. In cirrhosis, the liver's ability to produce albumin, a protein that helps maintain proper fluid balance, is impaired. As albumin levels decrease, fluid starts leaking from blood vessels into surrounding tissues, leading to abdominal bloating. At first, the swelling may seem mild, but as cirrhosis progresses, it can become quite pronounced. This swelling may be accompanied by a feeling of fullness, discomfort, or pain in your abdomen. Ascites also puts pressure on your diaphragm, making it harder to breathe. In severe cases, ascites may lead to complications like spontaneous bacterial peritonitis, a bacterial infection in the fluid, or difficulty with mobility. If you experience significant abdominal swelling, especially with difficulty breathing, it's critical to seek medical care immediately. Number 3. Spider angiomas. Spider angiomas are small, red, spider-like blood vessels that appear on your skin, often on the face, neck, chest, or hands. These blood vessels are caused by changes in hormone levels, particularly an increase in estrogen, which the liver is normally responsible for metabolizing. When your liver is damaged, it becomes less efficient at processing these hormones, leading to the formation of spider angiomas. While these blood vessels themselves are harmless, they can be an early sign of liver dysfunction. If you notice spider angiomas, particularly when they appear alongside other symptoms like jaundice or fatigue, it's important to have a healthcare professional assess your liver function to determine whether cirrhosis or another liver condition is present. Number 4. Confusion and cognitive changes. Cognitive changes, such as confusion, forgetfulness, and difficulty concentrating, are signs that cirrhosis is affecting brain function. This condition, known as hepatic encephalopathy, is caused by the buildup of toxins, especially ammonia, in the bloodstream due to liver failure. As these toxins accumulate, they can interfere with brain function, leading to mental confusion and other cognitive symptoms. In the early stages of hepatic encephalopathy, you may become slightly forgetful or experience difficulty concentrating. However, if left untreated, it can progress to more severe cognitive disturbances, including disorientation, personality changes, and even coma. Hepatic encephalopathy is a medical emergency that requires prompt treatment to prevent irreversible brain damage. If you or a loved one notice significant changes in mental clarity, it is crucial to seek immediate medical attention. Number 5. Loss of appetite and unexplained weight loss. A significant loss of appetite is another common symptom of cirrhosis. As the liver's ability to process nutrients diminishes, it can lead to feelings of fullness and discomfort after eating small amounts of food. This may result in a reduced desire to eat, which, when combined with nausea and vomiting, can cause noticeable weight loss. Unexplained weight loss is particularly concerning, as it may indicate that your body is not receiving adequate nutrition. Over time, this can lead to muscle wasting, further weakness, and fatigue. If you're losing weight unintentionally or experiencing a significant decrease in appetite, it's important to consult with your doctor to address the underlying liver dysfunction and prevent further nutritional deficiencies. Number 6. Fatigue and weakness. Fatigue is one of the most common symptoms in people with liver cirrhosis, and it can significantly impact daily life. Unlike typical tiredness from physical exertion or lack of sleep, cirrhosis-related fatigue feels constant and overwhelming, affecting your ability to function normally. This fatigue is largely due to the liver's inability to detoxify the body and generate sufficient energy. Toxins, such as ammonia, accumulate in the bloodstream because your liver is not able to filter them out effectively, leading to feelings of exhaustion. As cirrhosis progresses, the liver's diminished ability to process nutrients can also result in malnutrition and muscle wasting, further contributing to the feeling of weakness. In many cases, the fatigue may be accompanied by a lack of motivation, making even simple activities feel exhausting. If fatigue is impacting your ability to carry out everyday tasks, it's important to discuss it with your healthcare provider. Number 7. Itchy skin. Itchy skin is a common and often distressing symptom of liver cirrhosis. This itchiness occurs due to the accumulation of bile salts in the bloodstream, which normally would be processed by your liver and excreted in bile. As the liver's ability to filter these substances diminishes, they build up and deposit in your skin, causing intense itching. The itchiness is often worse in the evening or at night, disrupting sleep and causing discomfort. Your skin may become irritated or inflamed from scratching, leading to potential infections. While itchy skin itself is not typically harmful, it is indicative of liver dysfunction and can be a sign that cirrhosis is progressing. If you're experiencing persistent, severe itching, it's important to seek medical advice to help manage the discomfort and address the underlying liver issue. Number 8. Nausea and vomiting. Chronic nausea and vomiting are frequent complaints in individuals with liver cirrhosis, particularly as the liver becomes less efficient at detoxifying the body. When your liver struggles to process toxins, these substances can irritate your gastrointestinal system, leading to nausea. Additionally, cirrhosis can impair the digestive process, resulting in bloating, discomfort, and vomiting. Persistent nausea and vomiting can interfere with appetite, leading to malnutrition and dehydration. If left untreated, this can exacerbate symptoms of fatigue, weakness, and weight loss. If nausea or vomiting becomes frequent and severe, it's important to consult a healthcare provider to manage these symptoms and ensure that the body remains properly nourished and hydrated. Number 9. Edema. Edema refers to the swelling of the legs, ankles, and feet caused by fluid retention. In cirrhosis, the liver's reduced ability to produce albumin leads to a drop in osmotic pressure, causing fluid to leak from the blood vessels and accumulate in the surrounding tissues. This results in visible swelling, which may be more pronounced at the end of the day or after standing for long periods. In severe cases, edema can extend to other areas of the body, including your abdomen, and cause significant discomfort. It may also be associated with ascites, which further complicates the issue. If you experience persistent swelling, especially in your legs or ankles, it's important to consult a doctor for evaluation and treatment to prevent complications such as skin ulcers or infections. Number 10. Jaundice. Jaundice, characterized by yellowing of the skin and the whites of the eyes, is one of the most visible and definitive signs of liver damage. Your liver is responsible for processing bilirubin, a substance produced when red blood cells break down. However, in cirrhosis, your liver becomes inefficient at handling bilirubin, leading to its buildup in the blood. This excess bilirubin then deposits in tissues, causing the yellowish appearance associated with jaundice. While jaundice typically starts in the eyes, it gradually spreads to the skin and mucous membranes. It may be subtle at first, but over time, it becomes more pronounced. Jaundice is often accompanied by itching, which occurs when excess bile salts accumulate in your skin. This discomfort can be severe, making it difficult to focus on daily activities or sleep comfortably. If you notice a yellowish tint in your skin or eyes, seek medical attention promptly as it indicates significant liver dysfunction. Number 11. Dark urine. Dark urine is often a sign that bilirubin, a waste product that your liver normally processes, is building up in the bloodstream. In cirrhosis, the liver's ability to excrete bilirubin is compromised, and it may spill over into the urine, causing it to take on a dark amber color. If you notice that your urine is consistently darker than usual, particularly when accompanied by other symptoms such as jaundice or abdominal swelling, it may indicate liver dysfunction. Dark urine is an important red flag that requires medical attention, as it could signal worsening liver disease or the onset of liver failure. Number 12. Fecal incontinence. Fecal incontinence is the inability to control bowel movements, leading to unintended leakage of stool. This condition can be an especially embarrassing and distressing symptom of cirrhosis. Fecal incontinence in cirrhosis is most often associated with hepatic encephalopathy, a complication of liver failure that results from the accumulation of toxins like ammonia in the blood. When your liver is unable to process and eliminate these toxins, they can affect brain function, including the ability to control bowel movements. In cirrhosis, the digestive system is also compromised, which can lead to diarrhea or frequent urgent bowel movements, making fecal control difficult. In addition to being physically uncomfortable, fecal incontinence can have a significant impact on emotional well-being, often leading to social isolation and depression. Managing fecal incontinence often requires addressing the liver disease itself, but lifestyle modifications, such as dietary changes or medications, may help to alleviate symptoms. If you experience this symptom, don't hesitate to reach out to your doctor for support. Those were the 12 signs of liver cirrhosis. Did you know that having liver cirrhosis can increase your risk of developing breast cancer? Check out this video to learn about 12 signs you may have breast cancer. Thanks for watching. See you in the next video.